Stockpiles of life-saving antiviral COVID-19 treatments like Paxlovid have been sitting on shelves unused. The White House is launching a new push to make people more aware of them and to make them available at more pharmacies. Infectious disease expert Dr. Hlatshwayo Davis joins us now from St. Louis. She's also the director of the city's Department of Health. So let's talk about first why these are highly effective treatments for COVID and how they can help people keep out of hospitals.
Has been really a drug that has been a triumph for us because it's provided us an easy option, a pill option. Before, people had to come in and get intravenous therapies, but now they can take a simple pill. And what this pill does is it decreases your chances of having severe illness, so being hospitalized, put on a ventilator, and decreases your chances of death, keeping you healthy, keeping you safe.
So this sounds great. But we've got this prescription sitting on the shelves.
Unused.
Unused. So I don't know if it's like bad marketing, for lack of a better term, but why has it been going unused? And can anyone get a prescription for it?
It was a challenging rollout from the beginning. And so as a public health director, this is something I saw firsthand. Unfortunately, supply was limited in the beginning. And so the rollout was limited. They had to give it to hospitals, certain healthcare providers, and even they had to make a decision about who would get it. So this wasn't from the impetus a drug that was made clear to the public was available, because quite frankly, in the beginning it wasn't. And this may vary, from geographically. I'll be honest with you. I run a smaller health department compared to what you see on the coast and some of the other bigger cities who may have had bigger supply. But the reality for a Midwest city like St. Louis is that when I met with hospital CEOs, when this first was rolled out, we had less than 200 pills in a hospital at a time and decisions being made about who would get them. That's what made the rollout so difficult.
So our White House correspondent Nancy Cordes is reporting that the president's plan is one that would allow people to get tested at a pharmacy. Right? You've got some symptoms that you think might be COVID-19. You can get a test at a pharmacy. And once you are deemed to be infected with COVID-19, you can get the treatment right there. In other words, the plan is for one-stop shopping. Right, exactly. Is that how it's going to roll out also in St. Louis?
Listen, I'm going to be very honest and say that while I am so happy to hear that they want to make this more accessible, that they want to make it easier on individuals, I also want to challenge leadership to understand that we have learned a lot through the pandemic. And one of those things is while pharmacies bridge a much needed gap, they are not the only answer, in that the most minoritized, the most vulnerable amongst us, those neighborhoods, continue to have pharmacy deserts. So it's important that while we roll out a test to treat plan, that we couple that with a communication strategy that educates folks, because, per the last question you gave me, a lot of people don't even know about this pill because it wasn't easily accessible in the beginning, but that we continue to address what health disparities have made clear over this whole pandemic, which is that for those minoritized zip codes, this will not bridge the gap. I would love to hear more in a comprehensive plan about what's being done to empower our FQHCs, small community groups, and the trusted messengers who are sometimes non-traditional that have earned the trust in those neighborhoods.
Those are all great points.
Yes.
And I believe after, the conversations that we have had over the last couple of years now about this virus, I don't think we've talked about that.
No.
We've not talked about pharmacy deserts. But I do want to talk to you about something else that I'm learning right now. They're still working on, a COVID vaccine for the under 5 crowd. But remdesivir, has that now been approved for younger children?
So yes, the FDA has approved remdesivir for younger children. I'll be honest with you that a lot of us are still reviewing that data, looking at it. But something that has been proven to be safe and effective for children is always something that we welcome. While we know that children do not pose as high of a risk for severe disease and certainly death than adults, any child in a hospital, any child that dies, is an absolute tragedy, right? And so especially for parents who have been waiting for over 2 years now for a vaccine that is available for children under the age of 5, most of whom cannot even wear a mask appropriately, it's made it difficult to feel like they can keep their kids safe. So to have a drug on the market that is safe and effective for that age group is really great.
Yeah. Dr. Hlatshwayo Davis, it's really great talking to you. Thank you.
Thank you.
Thank you so much for having me.